I don't think we've ever had, actually, I can say this for sure. We've never had someone with the credentials that Kathy has on our show.
I don't
Ever.
think we've ever had anyone on our show with any real credentials at all.
No,
I'm
not
kidding. No, we've had
not the ones that are acceptable by like, like the educational institutions and like the U.S. government. Like
Right.
the credentials that we have are like, they're like badges and patches, and, like initials that you put after your name with a year, and it's because you hiked that trail, not because you went to school for a long time. little different. So with that, let me introduce our guest tonight. Our guest is Dr. Kathryn Michels, aka Kathy. Kathy, welcome to our show. Thank you for coming.
Hi, thank you.
We felt it would be prudent to put out an episode about the current situation that we have going on with coronavirus, aka COVID-19. And Kathy happens to be an immunologist. Is that correct? Can you tell us a little bit about yourself and what your credentials are?
Yeah, sure. So my name is Kathryn Michels. I am a postdoctoral researcher at the University of Michigan in the Department of Pathology. And right now I'm studying respiratory viral infections of a completely different variety than COVID-19. And I have my PhD in microbiology, immunology, and cancer from the University of Virginia.
That's a mouthful.
University of Virginia holds a special place in my heart because it is my almost mater.
Your almost mater?
Yeah, I can't say alma mater because I didn't go there, but I almost went there.
You almost went there. I like that.
Yeah.
I like that. And Kathy, you also have some other credentials that people on this show would recognize, correct?
Correct. I am a 2017 southbound CDT hiker.
Woohoo,
awesome. Woo! Those are the credentials I was talking about that you usually see those ones.
The usual ones, right?
Yeah. Not accepted though by the educational community or research community or like the US government for some reason. I don't know why my employer won't let me call myself doctor. I don't know. So thank you so much for joining us. I know this is like really last minute. I think, like I said, I felt it prudent that we talk about this situation, especially since we're seeing more emails, especially if you're part of any of these trail maintenance organizations or like if you're on the ATC's email list or the AZT's email list. There's a lot of stuff, a lot of information out there that's geared towards hikers in light of the current situation. So I want to kind of quickly, my goal here is kind of like go over what we're kind of dealing with right now and then talk about how that impacts our hiking community and go over like what we can all do to help. But I really want to start like ground level for the people who are living in their basement right now. I don't know how many hikers are actually living in basements, but
actually, Megan, right now, I think everybody's living in their basements right now.
Everyone's living in their basements right now.
We're all trapped.
Or everyone's like staying at home right now. So I guess maybe everyone is. But that being said, those people who are staying indoors and trying to pay attention to the news, I don't know where they're getting their news from. I'm quite skeptical of the stuff that's on Facebook. That's why I don't really ever go on Facebook, even though I have one. Sorry, everyone who sent me messages and friend requests. I don't ever go there. So there's a lot of information going around that's probably inaccurate. So, we have a small platform here. Felt like it would be prudent to use that to kind of talk a little bit about what coronavirus is, what COVID-19 is, and what's going on with that situation. So let's just dive into what is COVID-19. What's the difference between COVID-19 and coronavirus? Let's start with that because people are using them interchangeably.
So coronavirus is a large group of viruses, and they range from viruses that infect bats, armadillos, cows, dogs. They can cause a very mild respiratory diseases that never escalate into anything serious. So coronavirus is a big category. COVID-19 is a type of coronavirus, and it is the coronavirus to worry about because in a small but very, very significant proportion of individuals, it can cause a severe respiratory distress syndrome that requires ventilation and in some cases causes death.
So everyone's been using this term coronavirus kind of interchangeably with COVID-19. But is it fair to say that not all coronaviruses are deadly, but when we hear the term coronavirus, we should just automatically think COVID-19 because that's what's happening right now?
Probably at this point, yeah. It's easier to say. It's a shorthand. Coronavirus is a little bit easier to fit together than COVID-19. So I'd say at this point, it is the coronavirus to be talking about.
So what I know, because I pay attention to the news, is I do know that recently the WHO, which for those who don't know what WHO is, the World Health Organization, recently called COVID-19, officially called it a pandemic, although I know that word was circulating before. And I know you have a particular interest in historical diseases and their spread. So can you maybe talk a little bit about what it means to be a pandemic and why COVID-19 is now being called a pandemic and kind of like what historical precedents might even be out there?
So COVID-19 is now considered a pandemic based on the number of countries it has spread to and the fact that it's now deeply entrenched within, I think the count is up to over 100 different nations.
Wow.
That's essentially the widespread is why it's being considered, it's reached the definition of pandemic at this point. We've had circulations of pandemics before. There are several types of influenza. There are several strains of influenza that have circulated in the past as pandemics, but they've done so with differing severity. So there've been, there was the 1968 Hong Kong flu, which was pretty serious. There was the there was the swine flu, which ended up being not quite as bad as we thought it would be in terms of overall cases and fatality rates and things like that. And of course, there's the big famous one that probably is what comes to people's mind when they think pandemic, which is the 1918 Spanish flu, which was an absolutely devastating event and was a world-changing event. Very, very significant.
So when we're hearing about COVID-19 in the news, and of course, I mean, I'm sure there are a lot of people that don't really remember much about some of these pandemics or maybe haven't learned a ton about it. Is there any way for people in the healthcare community and public health or in like the research community to predict how bad or how severe something like this is going to be? Is there something that they can do? Because I mean, when you hear the word pandemic, you're like, well, could it be, H1N1 where it wasn't as bad as everyone thought it could be? Or is this the Spanish flu again?
So there are several different ways that researchers can use to track how bad something will be and how bad it's likely to be. And this is based on, you can look at, say, in a given country or a given outbreak area, what increase of cases you're getting each day and your overall case fatality rate. And so you can you can look at different regions and you can look at, okay, this is how fast it spread in Wuhan, China. This is how fast it spread in South Korea. This is how fast it spread in Italy. And you can make predictions that converge to a pretty accurate point and guess, okay, if this is how many cases we have right now in the United States, here's a trajectory where if we do nothing, we make no changes to our behavior, here are the cases where we'll end up. And when we've done, some of those trajectories for COVID-19 right now look very, very, very bad for the United States in the absence of mitigation.
So when you say some of those situations look bad, I mean, are you specifically referring to like a case fatality rate, or is that's a portion of it?
So it's a portion of it is the case fatality rate. So by what I would call moderate estimates, they might be on the edge of conservative. I would call them a little bit more moderate. You could be looking at, in some models, 500,000 deaths in the United States in this season from this virus. And that is bad enough. The real problem, though, comes down to the proportion of people who will need critical care. It's not necessarily that you're going to have X number of that many people who all at once show up in the hospitals needing advanced life support. And we need advanced life support for a lot of things. We need it for car crash victims. We need it for people undergoing surgeries. We need it for people who come in sick from who might be undergoing cancer treatment. We need it for a lot of different things. And we just don't have the capacity in this country to support the number of critical care patients that could be dumped onto a hospital during the course of this pandemic.
So when people talk about, I know I've seen this, I'm sure people are seeing this on social media. I'm sure it's going around, but I have heard, and I mean, also I've heard it from public officials in the United States, but, we've heard that, this isn't as bad as the flu. We get the flu every year, the flu goes around, and more people have died worldwide because of the flu than COVID-19. Why? I mean, I know that based on the facts here to be a misleading statement. Why is that misleading to say that, COVID-19 doesn't kill as many people or hasn't killed as many people as the flu?
So right now, the case, and it depends where you are in the world, but the number of COVID-19 cases and the number of COVID-19 deaths doubles about every 5 days. So you keep, 2, 4, 8, 16, 32, before too many divisions, you've gone to 2,048. So it just is this exponential increase. And we know it does that because it's had a relatively reliable history of it lands in a country, and this is how fast it grows. So there were maybe a couple of weeks ago, we could still hold to that hope, hey, maybe this is just another flu. Maybe, it'll make the rounds, but it'll be okay. But it has not been behaving that way for the past 2 months. It really has been landing in a region and just growing exponentially and causing really serious problems in countries that have not taken appropriate measures.
Oh, that leads me to a question I don't want to know the answer to, because I kind of already do, but it leads me to the question of, do you see, based on what we've seen in the news, do you feel our country has taken the appropriate measures to prevent the spread of COVID-19 or mitigate its effects now that it's here?
So there have been 2 pretty critical failures in the course of how the country has handled COVID-19. The biggest one is failure to get testing, to get an organized system for testing. There were some early failures with, the first test just wasn't very effective. And then following up in later attempts, there's been a bunch of bureaucratic red tape and confusions over regulation as to how to get a COVID-19 test into production. So that's been the case. You are about to see a massive increase in the next few days of COVID-19 cases simply because we're finally testing people for it in a more systematic way. So for the past month or so, we've been flying completely blind in this country with where this virus is, who's been transmitting it, who's been getting it. We just have no idea what that looks like. And the second way in which, the government's been a little bit slow to respond are on the shutdown measures. And I don't like saying it, and no one likes getting to that point. But if you want to look at our future, take a look at what's happening in France and Italy and Iran and Germany right about now. The situation there is getting very, very dark and very, very scary. And, you look at their case numbers, you look at our case numbers, you look at the time to double with this virus, and we are not very far off from that happening unless there are more aggressive steps to contain it.
Oh, well, now I'm thoroughly scared.
Do you mind if I ask some questions?
Feel free to jump in. I need to let all of that information just sink in a little bit more.
Okay. Kathy, are you okay with us outing you as a Redditor?
Yeah, sure, that's fine.
Yeah, so I think it bears commenting on how we all crossed paths. One of the things I do in addition to hosting this podcast is one of the moderators on the Appalachian Trail subreddit, and there's a post that I saw the other day that actually was I think it was like less than 1 day ago, that I thought was important enough that I stickied it to the top of that page. And it was written by our guest this evening. Kathy goes by Dr. Peanuts. That was your trail name on the CDT, right?
It was Mystery Peanuts, but that was taken on Reddit, so I had to do Dr. Peanuts instead.
That's pretty fitting.
Well, Mr. Peanut only has a master's degree as far as I know, so screw that guy. We're not listening to him. Do you mind if I take a quick sidebar and ask you a little bit about your hike, and we can start with how you got your trail name? If you don't care.
So my trail name was, I was wearing Saucony peregrine shoes, and I was in the Anaconda Pintlers, and all day I had been trailed for several days. There were 2 hikers behind me, a Chicory and Ho-Ho. And after it's such a sparse trail, especially southbound, that you can really start figuring out who's around you based on the shoe prints. And just because there's
awesome.
not a lot of people to keep track of, it's pretty easy to do that. And so they were like, oh, whose shoe print is this? Because the Saucony peregrine, it kind of looks like peanut. It kind of looks like little peanuts. It's like the shoe is shoe, and the little divots that the tread makes looks a lot like a peanut. So they were like, oh my gosh, who is this? And so if they finally caught up to me and overtook me, like, you're the peanut lady. And so there we go.
That's awesome. Yeah, I know on the AT and maybe on the PCT, people kind of track each other based on, like, you see a group of packs leaning against the door at a convenience store, and you're like, oh yeah, I know who's in there. Or I remember coming into a shelter and like recognizing distinct smells, like, oh, Lemmy's here.
Ooh,
for sure.
That's gross, but I mean, it makes sense. Like, oh, that's my friend. That's Green Giant. Oh no, that's someone else. Oh, gotta get moving.
Well, I wanted to talk a little bit about your experience as a hiker, just to kind of remind our listeners that the person that we're talking to is not just some East Coast elitist in her ivory tower making declarations about what we should do, because she's been out there, like, she's got dirt under her toenails just like we do. But this post on Reddit, I want to ask you, it seems like most of the response to this has been positive, and I'm going to describe it here in a second. I've actually got it up on my screen right now, and there aren't too many. On Reddit, the negative or toxic style posts tend to get downvoted and drop to the bottom of the page. I don't see too many here. I know other people who have suggested, I've completely danced around the subject too much. The title of this post is, "Please reconsider a northbound thru hike. The unsanitary conditions common with the pack puts local communities at risk." Now, I've seen various posts with this message on social media throughout the day and the last couple of days. And, just from interacting with the people who wrote those, they were saying that they got a lot of negative energy directed at them through, like, DMs or just, straight up people saying, bad things to them online. What's the reception been like to this post of yours?
I would say it's mostly been pretty positive and supportive. I would say actually the majority of it has been quite positive, and it's a mixture of people who've come to this decision or conclusion on their own over the last couple of days, or people who it's been on their minds, it's been working at them, and they kind of are starting to realize that's probably the right thing to do. And of course, a number of, I was called an interesting number of names as well. So that's to be expected. But overall, it's been pretty positive. I think because a lot of people realize that overall the sentiment's true.
Mm-hmm. Yeah. And it's a pretty difficult stance to take too. I mean, you're recommending that people reconsider their thru hike. And for a lot of people, this is things they've been dreaming about, not just for years. In some cases, I'm raising my hand here. It was a dream for multiple decades before I finally got onto the trail. So a lot of people, are experiencing disappointment right now at a level that they never have before. But I'm going to go on record as saying that I stand with you on this. I think it's the right thing to do. If you're a northbounder right now, you might want to reconsider. If you haven't started yet, maybe put your plans on hold. Think about a southbound hike later in the year. Maybe a section hike. Just, right now is just a really bad time. And I'm not the best person to articulate why. If only we had a PhD immunologist on the line.
Oh, if only.
Yeah, and I don't. This post has. I'm looking at it right now. There's 105 comments, and the discussion is really lengthy and in depth and mostly positive. I'm not going to sit here and just read a Reddit post, but if you don't mind, one of the top comments in here is your response to the hypothetical question. I'm careful, I'm safe, so is everyone around me. Why shouldn't I go out? I'm not gonna catch it. What's the flaw in that reasoning?
So the key flaw in that, so just to restate, a big amount of criticism that comes to it are people that say, look, you're not going to spread disease if you're careful and if you're sanitary, and I'm not going to spread it, so I don't need to worry about it, so I should just go. And the flaw with that logic is, my question is, have you ever caught a common cold before? You can do things really well and be really careful and still catch a cold and still get sick. You can be as careful as you can and still spread your cold or your sickness to someone else, even if, by all of your efforts, you're trying not to. And the conditions that are created along the Appalachian Trail, particularly with like a big group of hikers that want to be in part of a community and want to walk together and want to have this journey together, that situation creates conditions that are fundamentally great zones to spread this disease very quickly.
And not everybody who gets it knows they have it, right? Is that true? Or?
That appears to absolutely be the case. So probably the country we can look to who has the best data on who gets this disease is South Korea. Now, most countries right now are tracking COVID-19 cases by contact tracing. That is, they will not really test you for COVID-19 unless you have been in direct contact with someone who has been shown to be COVID-19 positive, or if you have a travel history to COVID-19 hot areas. South Korea, very, very early on in this outbreak, have been systematically testing people at random all the time, everywhere. So they have a really great database for understanding who is carrying this disease. And as it turns out, so the mortality rate of this disease in people 60s, 70s, 80s is very high. It's 5 to 10%, depending, or even higher, depending exactly on the age and underlying factors. But for people in their early 20s, mid-20s, mid-30s, it's just a little cough. It's just maybe a day of fever, maybe a little bit of coughing, and then nothing remarkable. Many people have very mild cases and just don't know they have it. There's a proportion, it's a lot of disagreement about how big it is, but there's probably about 20% of people who carry it and never have any symptoms at all.
And those people are coming into contact with townies, right? I mean, think about all the people who you've hitchhiked with or stood next to in the laundromat or slept in their bed in their house because they were kind, I mean, we obviously want all of the hikers to remain healthy too, but we got Crazy Larry to think about, man. That guy, he can't handle this. Think about Larry.
Yeah, and that's really my main concern for making the post is if it were, a couple hundred, or depending how large the start year is, up to 3,000 people who say, you know what, I'm accepting the risk and I'm doing it, I'd say, okay, well, that's fine. That's up to you. But it's the fact that the Appalachian Trail is very closely entwined with the surrounding community. it's a densely populated area in some places. It's other places, it's rural towns without a lot of limited services. And so if you have a lot of people who've been passing, potentially passing this pathogen back and forth in a very close environment between each other, and then all crowd into the same hotel or restaurant, that's exactly the type of situation that is unfortunately causing the spread of this disease in other places and in the U.S. as well.
Yeah. One of the things, unfortunately, thru hikers are notorious for is kind of being like the horde of the swarm of locusts that descends upon a town. I mean, we're known for overwhelming the resources as the bubble moves through. I mean, think about how hard it is to find a pancake in Damascus. Imagine trying to find a hospital bed.
Yeah, I mean, so, like I say, I'm southbound CDT. So that's like, if you see 10 CDT hikers at the same time, it's like, oh my God, wow. What is this
the bubble
crowd? So but like pinch points happen there as well. I mean, I got pushed off in the San Juans by a snowstorm and diverted to Silverton. And there, it was kind of a bad storm. And during the day, these Colorado Trail hikers and CDT hikers were increasingly traumatized and hypothermic, crawling out of the mountain. And there's one place to stay. And they went over capacity to let us stay there. So even on like a relatively, even with a small group, you end up fleeing to the same places in a large group.
Yeah.
Oh man.
Yeah, I'm laughing. It's not funny, but I'm laughing because at this point, what can you do? I mean, let's consider that as a question.
I do want to talk about what we can do.
Yeah.
Can we talk about what we can do? Because I think, of course, I share the same opinion that if you're planning a long distance thru hike, that's for this year, that's probably not the best thing to do. It's not just yourself, it's the other people you're going to come into contact with, even if you just are walking within 2 feet of them, which you're going to walk within 2 feet of plenty of people out there. But I do want to talk about what we can do to help, what is effective. And I also want, because, there are a lot of people still, I'm sure there's still some people who are like, well, lots of people aren't going to go, but I can stay in my tent. I will not stay in hostels. I'll do my own thing. I'll stay in the woods as much as I want and avoid people as much as possible. So there might be some people out there thinking like this could be their solution. I want to take a look at what is the most effective way to prevent getting COVID-19 and becoming a carrier of that. And then ask the question, is it compatible with hiking, period? So let's first talk about what can we do to prevent the spread of COVID-19? What's the current recommendations? So
the most important current recommendations and the earliest recommendations that were rolled out are the basics. Wash your hands frequently, cover your cough really, really well, and cover it with cough into a tissue and throw the tissue away, and go wash your hands right away afterwards. We've been telling people that for 3 months, and cases are going up and up. Okay, so now we have to increase the tactics a little bit. Don't touch your face. Don't go outside when you're sick. Don't go outside if you think you might be sick. Don't stand next to people who are sick. And we tried that for a while. And in China and Italy and Iran, the cases are going up and up and up. So now what worked in China is you close down schools, close down all public services, close down everything except the grocery store, and hide inside your apartment. And that worked slowly. It took about 2 weeks for those extreme measures to turn the tide. So Italy is looking at a similar type of lockdown right now, where the cases were climbing and climbing and climbing, and people have been ordered inside of their homes. And if you walk out on the street, unless you have a very specific place of business to go to, the police will yell at you and tell you to go back home. And France has just deployed 100,000 police officers to enforce staying at home. So that's what the tactics you have to use for this pandemic if you don't act soon enough. What we can do now is something called social distancing. And that is a more moderate technique, but it's still very different than what you might have done before. And that is basically try to keep your social circle for the next several weeks very, very limited. Try to interact only with people who live in your house. Try to stand 6 feet away from other people at all times. If you can work from home, work from home. Cancel that dinner party. Don't go to that church service. Don't go to that birthday party. And it's really, really sad that those are the types of restrictions that are not restrictions, but behaviors now. But that's what it's going to take. It is going to take that type of behavioral change if we want to break this pandemic early and we don't end up literally shut inside our houses like a lot of the world is about to be. So on the trail, what that accounts to is, there's certainly hikes where you can keep those social distancing rules, no problem. There's nothing wrong at this point with hiking. You can drive up to it. In fact, hiking is a great social distancing measure as long as you're very solitary about it. You drive up to the trail, you get your backpack out, you go spend a few nights out in the woods by yourself. It's perfect. I think people's idea that they're going to get on the Appalachian Trail with the northbound bubble and be able to maintain those social distancing rules is a little bit unrealistic. I mean, you're talking about, I'm not going to stay in hostels. I'm always just going to be out in my tent the entire 6 months on the trail. I mean, do you want to do a thru hike and never get to go into a hotel? I'm never going to eat in a restaurant. So I guess the people who are saying, look, I can do a northbound thru hike, but I'm just going to limit myself to all these activities, no hostels, no eating in restaurants with other people, no hanging out in shelters with other people, no hanging in groups. I think that takes away a lot of the fun of what people expect to get out of this thru hike. And it changes the nature of what an ATU thru hike would be to such an extent that I'm not quite sure you would want to go.
The other thing that you mentioned first, the very first thing that we can do.
Sorry, I rambled on.
No.
Perfect.
No, that was perfect. That was we need to hear all of that. The basic, simple thing that I want, because this is for my own personal, I feel like I have to say this because I've been saying it to anybody who will listen. I met up with a driver from work today to pick something up, and I told him this, and I'm just astonished by the number of people who don't know how to properly wash their hands. And I only know how to wash my hands properly because in my first job out of college, I was working at a hospital. I was a little peon, but in my department, we did this awesome little thing where we put lotion on our hands, which was, what's that word I'm looking for? It's fluorescent, I guess. So it would glow under a black light.
Yeah,
so we put that lotion on our hands all over, and then we were instructed to wash our hands for the recommended 20 seconds, although you'll also hear 30 seconds. I washed my hands for the recommended period of time, at least 20 seconds. I sang my little song in my head, washed my hands, and then my hands were put under a black light, and I failed. I still had stuff on my hands. And the reason is that I washed my hands for the right amount of time. I used soap, I used warm water, but I didn't do it properly because I missed my thumb. That's a huge place that people miss. And I missed my fingernails. And so I've been telling anybody who will listen to go just to YouTube or any website that's reputable, like WHO or the CDC, or you could just go to YouTube, honestly, and type in proper hand washing technique. And there's some great videos out there that show you how to properly wash your hands. And that's like you said it right up top. That is the number one thing that was the first thing we recommended was wash your hands. But people suck at washing their hands.
Well,
they really do.
Go ahead.
Frankly, it's hard to wash your hands correctly without running water, like when you're on the trail.
Exactly.
It's really hard to get that stream going long enough to make a difference. I think a lot of people have a misconception about why washing your hands is effective. It's not like soap touches the germs on your hand and kills it. It's, you have this layer of oil on your hands and it's, the oil is normal. That's just your skin making oil. And that's where all the germs get trapped, is in that layer of oil. So when you're washing your hands with soap, the antibiotic part doesn't matter at all. Forget it. The antibiotic soap normal soap is completely fine. What you're doing is you're lifting up that layer of oil that's on your hands and rinsing it away. So if you're not thorough and you're not getting every nook and cranny and you're not really like doing the motions to lift that layer up, you're going to be missing spots. And it's very hard to wash your hands properly in the woods because you just don't have that running stream of water.
And the alternative to
sorry.
Oh no, I think Gary, did you
We're here.
hear that?
No.
Okay.
The last 5 seconds.
She cut out on my end. I just didn't know if she cut out on your end too.
Yeah.
Oh, fudge.
No, we're good. Keep going.
Okay. Well, the secondary thing to washing your hands if you don't have soap and water is hand sanitizer. I don't know that but I think a lot of hikers carry hand sanitizer with them as an alternative to soap and water. But I'm trying to think of like the volume of hand sanitizer you would need to carry on a thru hike to effectively actually like wash your hands or clean your hands when needed.
A lot. Hand sanitizer is good, but it's not the best. It's not nearly as effective against viruses as washing your hands with normal soap and water is. And you kind of have to use a lot and let it sit there on your hands for a while. The problem with hand sanitizer is it actually evaporates really quickly and it doesn't have enough time to sit there, with the bacteria and viruses and whatever on your hands to kill them a lot of the time. So, yeah, to, effectively wash your hands with hand sanitizer, you have to use a lot. And I don't know about you, but I have not seen any hand sanitizer in the grocery store in a long time. So
yeah, that is so true. It is not on shelves. So I don't know how any hiker is going to be able to carry the proper volume of hand sanitizer in order to keep up with sanitizing their hands if you can't get it in the grocery store or anywhere or on Amazon.
Grocery store today, and I asked the guy, I was like, just out of curiosity, not that I need any, but do you guys have any hand sanitizer? And he just looked at me and he was like, nah, man, nah.
Yeah. I was actually at a doctor's office on Friday. And the doctor's office did not have hand sanitizer.
Wow.
If you want any place to have hand sanitizer, you want a doctor's office to have hand sanitizer. And it was simply because, it was just it's supply and demand. There's just not enough of it. And they hadn't yet received a shipment from their medical supplier. And I'm pretty sure they were getting it like that day or over the weekend or something. But the point being is that there's such a strain on those resources right now. But I can tell you that soap is readily available. And inside your home, at least for a majority of Americans in the United States of America, there's running water. Great way to keep your hands clean.
It's kind of crazy that you're talking about, the doctor's office being out of hand sanitizer because I don't know if a lot of the listeners know, but I work in a hospital intensive care unit, and people have been stealing supplies from the hospital.
Yes.
What?
Seriously, yeah. We now we have to sign out for, sanitary wipes, like bleach wipes and stuff like that. If we want a container of those, we have to sign out for it. If you want a mask, you have to sign out for it. They're all under lock and key now because I guess, because of the scare, I don't know, whoever in the hospital is doing it, but, I'm talking about stealing massive amounts of not only masks, but, Clorox or bleach wipes, all that stuff.
To add to what, go ahead, Reptar.
I was going to say, fortunately, our hand sanitizer is mounted to the wall. So unless they take the whole unit off the wall,
they got to rip it off.
Yeah.
And for some unknown reason, this week's show notes will contain a link to Reptar's eBay page. Is that right? Why are we doing
Where
this?
you can actually get
no.
disinfecting wipes and hand sanitizer. No, I'm kidding.
It's on the hush, Gary. It's on the hush.
No. We'll cut that part out.
To add to Kathy's statement about a slow response initially in the United States, we also dealt with some misinformation. And I mean, when people hear a lot about a respiratory illness, everyone goes out and buys masks. So masks sold out very quickly, and then people started stealing them from hospitals, which, masks are not
cool.
effective. Masks are super effective if you're sick and you're wearing it. It's a great way to protect the people who are taking care of you, who are bringing you food and water and leaving them hopefully by your door and stepping back and then letting you come and pick it up so that they keep a nice distance. Or for people in the hospital setting, they're really needed for providers who are working in a hospital setting and actually working with patients who have COVID-19, and they need to protect themselves against that. They're not effective if you're just a normal person just walking around and like, you're not going to catch it from just breathing air. So there was a lot of that. So there's a rush for those masks, and then there was a rush for the disinfectant wipes and the hand sanitizer and all that stuff. But I mean, good old fashioned soap and water, y'all.
I cannot champion that statement enough. Like, because so many people are freaking out and taking supplies, like it's causing shortages for the people that actually need them. And I mean, like, if you're, 20 something, 30 something, good health, there's no reason why you should be out there hoarding, sanitary wipes or toilet paper or this, that, and the other. Because I mean, if you think about like the at-risk people, the, elderly who actually stand a really good chance at contracting this. I mean, save it for the people that actually need it, or the medical professionals, like that's why when they approached us and told us that people were stealing supplies from the hospital, it was like, are you serious? Like, why are you going to take it from the one place that actually needs it?
I think that's such a huge, important message, especially since we were like right up top when we were talking about what is this virus and why is it so dangerous? The biggest problem, like Kathy said, the biggest problem we're going to face is access to critical care and keeping up with the volume of patients that need critical care all at once. And it's going to happen all at once. And the worst thing that we can do as a society for our fellow mankind, the worst thing we can do is hoard. Or maybe not the worst thing, there's more worse things. But one of the worst things we can do right now in this situation is hoard supplies and keep them from the people who actually need them. I don't need to go out and buy a box of nitrile gloves because I am not actually taking care of anybody. In fact, I bought some nitrile gloves the other day just because I like to use them when I'm working on my car or like doing stuff like that, because they're, putting in a light bulb or something. You don't get like your finger oils on things. But I have a box of them. And now I'm thinking like maybe at some point I might have to donate that to someone who actually needs them because I have an extra box. And I know there's a shortage right now and you cannot get gloves in a grocery store. But there's no need for me to have a stockpile of all of this crap. I mean, I'm a young, healthy person. If I get COVID-19, I'm going to self-isolate for the recommended time of 14 days, and I'm going to be just fine. But somebody else might not. Somebody else needs that stuff. So let's maybe PSA, be smart and think about your fellow humans, please, everyone.
Yeah. And I want to chime in again on that because, like you're saying, self-isolate for 14 days. Like right now at the hospital that I work at, granted, it's not a major city like, New York or something, but basically because there's limited testing or test kits available, I mean, you don't, at least in our hospital, you don't just walk in, get tested. They say, oh, no, you're good. And then you leave. Like what will happen is you'll go to the hospital, they'll test you for it, and it'll take like a few days for the turnaround. So unless you're in respiratory distress, they're just going to send you home and say, quarantine yourself for, 14 days, and we'll let you know the results in a few days, whether or not you have it,
At that, if you think you might have COVID-19 or you might have something, call your doctor's office, call the hospital, call someone before you go in. One of the worst things you can do is to show up with as long as you're not like dying and need to call an ambulance, if you're still able to like do things, one of the worst things you can do is be someone who has COVID-19 and show up to a hospital where there are immunocompromised people and people who are in vulnerable situations who probably already have compromised health. And all you're going to be doing is spreading it around. That's the message. What we're getting from public health officials is to call your primary care office. They're going to tell you to self-quarantine for 14 days. Call the hospital if you don't have a primary care physician, or your state's public health department. Every state has like a Department of Health and Human Services or a similar agency. And right now there are COVID-19 hotlines available. So if you don't have a PCP or you don't know how to get in contact with the hospital, you can't get through, try to call that department, or go online and find the information line for COVID-19. There's so many different resources out there, but the best thing you can do is just keep to yourself so you avoid spreading it. Because like we were talking about, this spreads very quickly. And even if you're someone who's going to recover, you might spread it accidentally, unknowingly to someone who won't recover. And that's where COVID-19 really takes grip on our country.
It is
good.
It is good at this point that just as a matter of practice and just as a matter of trying to slow this thing down, to start acting as if you might be infected. Even if you don't feel anything, you could be infectious and not realize it. And that's, why there's kind of been a movement started, and the CDC, I think, is finally catching up with their recommendations for just until this thing cools off. It's going to help a lot to just limit your social contacts for a while. And that's a big sacrifice, and that's really challenging to do. But the fact of the matter is that the data all seem to support the fact that this virus moves a lot through people who are either asymptomatic or have only very mild symptoms, and who just go about their day and say, I'm fine, everything's good, I'm not sick, I'm fine, I'm going to go to this concert, I'm going to go to this house party, and just not realize that they're doing it. So it's a time just kind of for a couple of weeks pretend you're infectious and stay at home as much or away from other people as much as possible, which really sucks, but it's kind of where we've gotten to at this point.
Can we maybe put a little bit of a fun spin on this and talk about things to do to kill 14 days when you're trapped at home?
Yes, let's do that. When you're working from home, and by working, I'm using like air quotes, when you're working from home, or your employer has said, hey, you don't come into the office. And when you need to just stay home, or like maybe you're in school, maybe you're like starting college spring break, and spring break now is never going to end, but you have to stay indoors. Let's talk about fun things to do indoors. Yay.
I like
hiking podcast talking about indoors activities. Woo!
No, you're supposed to go home, get on Google Maps, and plan your next hike.
That's a great plan. I love it. It's a great idea. Actually, I should do that.
Reptar, what do you do when no one else is around? Did I just open a can of worms?
Masturbate.
Oh no.
Oh God.
Oh no.
It's funny that you're actually, bringing this up, because I just saw today that there is, I think 13 or so different national parks that you can take a virtual tour of.
Oh.
Whoa.
Yeah.
How does one go about doing that?
I'll send you the link so you can put it in the show notes. But
that's a great idea.
So you can actually, even though you're cooped up in your house, quarantined, you can still go check out some really rad parks. Like, I think one of them was like Arches. I think Acadia is another one.
Nice.
I didn't get all the way through the list, but yeah, there's some pretty rad virtual tours that you can take of national parks, which I think is pretty badass. Or
that is awesome.
You could, try to shake yourself down, get your gear even lighter. I don't know. That's probably something I'd do, is just figure out how I can cut ounces.
Gary, what are you going to do?
So I want to recommend a couple of things. Well, obviously Netflix, Hulu, all your streaming services, I think those are going to go through the roof. I saw a prediction online today that, again, this is pure speculation, but major motion picture studios this summer are going to be forced to release their blockbusters directly to streaming because no one's going to theaters anymore.
Oh, yeah.
Yeah. So if you're a movie buff and you have, I mean, I was going to say a decent TV, but hell, at this point, if you've even got a decent phone, there's going to be a lot of good content coming your way. Some of the shows that I'm enjoying right now include Schitt's Creek. Have you guys ever seen Schitt's Creek?
I watched, I think maybe the first 5 episodes or so. It's one of the ones that like, I just didn't like it enough to keep watching it, or like life happened. And so I had to really bring the number of shows I was watching down. So that's going to be one of the ones I go for, because I got to finish that up.
Yeah, I was going to say
I love that show.
Black Mirror, but maybe, no, not that. Let's not do that.
It's a little
you could also go back and binge watch like full seasons of TV shows that maybe are from like your childhood or stuff that like you never watched. Like there's so many shows, at least for me, there's so many shows that people talk about all the time that I have never seen. And I am the type of person that I don't like starting. Part of the reason I don't watch those shows is because when someone tells me about it, they're in season 3 and I don't have enough time to go back to season 1 and start from the beginning. And I refuse to start watching a TV show either in the middle of an episode or in the middle of a season.
You do now.
Or even at the start of like the 3rd or 4th or 5th season. I will not do it. I got to go back to season 1, episode 1. I don't even care if it's a pilot. I'll watch the pilot first. Then I'll watch like whatever they consider to be their 1st or 2nd episode. And then I'll go from there. So that's what I'm going to do. I'm going to find something and start that early. I'm also going to listen to all of the audiobooks that I have on my phone that I have downloaded and not listened to, because I'm a wannabe reader. I want to read books. I want to be that person who reads books, but I fall asleep every single time a physical book is in front of me. It's like the best way to make me fall asleep is put a book in my hands and tell me to read it. I will pass out. So I got audiobooks, Audible, and we're not sponsored by Audible, but you know what? We should be right now. So I downloaded Audible. Maybe we should reach out to them. And I downloaded Audible. So I have all of these audiobooks that I want to listen to. And guess what? I do tons of driving and I have so many opportunities to listen to audiobooks. But what do I listen to instead? Shit music, pop music, anything, 90s music, good music, but a lot of shit music, because you know what? It is so much more fun to dance and sing to myself in my car than it is to listen to something educational. So maybe I'm going
to... your work.
Yeah, I'll listen to some Katy Perry. And that's right. I know who that is. I don't get most other references, but I know who that is because that is pop music that I listen to. Is it good music? I mean, it depends on your definition of good. So anyway, that's what I'm going to listen to. I'm going to listen to all the audiobooks that are going to make me smart. I'm finally going to finish Marie Kondo's The Art of Tidying Up or something like that. I'm going to finally finish that book. I started it.
Is that the woman that like does like the feng shui cleaning stuff?
It's not technically feng shui, because feng shui is a different thing, but she does do cleaning up. Yeah, her whole thing is
I've heard about this woman.
She's got a documentary out now. It's either a movie or something like that. Something about her, might be a TV series. I don't know. Marie Kondo.
Marie
Kondo, I think, is spelled with a K. Yeah. And so she's done like late night talk shows in the United States. And she's all about decluttering and like, you keep only the things that you love. So I am going to finally listen to this audiobook. And then maybe, since I'll be stuck indoors, I will use that and I will clean my whole house.
That actually sounds like a really productive use of time.
I feel like it totally would be.
Declutter everything.
And you guys know I recently moved to Vermont, so I did a really good job unpacking this time, guys. I got almost all of the boxes unpacked. However, there are still some boxes that need to be unpacked. And let's be real, Marie Kondo is probably going to tell me to throw everything away because those boxes have been sitting there and I haven't dug into them. But you know what? I've got a basement. I'm just going to throw it in the basement. But I'm still going to try. So that's going to be my goal for my quarantine time. So maybe you can do that too. I don't know.
All right.
I like the sound of that.
Yeah.
That sounds good. And exercise. I think exercise, audiobooks, and decluttering your life. I think those will all healthy for the mind. I think those are good. Next best thing to hiking.
That's it's very zen. Decluttering is very zen, which to me that's what hiking is. Hiking's like my zen time.
Yeah, or while you clean, instead of listening to an audiobook, you could just put on some the sounds of nature in the background.
Oh, there you go.
Get super zen with it.
Oh, there's this app called Calm. I use it to listen to thunderstorms to help me fall asleep.
I'll totally use it.
Yeah, which honestly, I guess I could just, like I said earlier, I guess I could just take out a book and try reading, but I prefer the sound of thunderstorms. But they have like all these little soundscapes. So I think they have like a rainforest and like a river and meadows. So that's the sound of nature. Put that on your loudspeaker. There.
My personal favorite is like Japanese pan flute while it's raining.
Oh,
man.
That's like my go-to. Like, okay, let's go.
I Google it because I'm imagining what it sounds like, but
super tranquil.
I gotta write that down. Kathy, is there anything that you're gonna do when you're stuck indoors?
Let's see. I say I'm gonna clean my house, but like I don't deep clean it, which is the perfect thing to do right now. I'm thinking about trying to teach my dog some really stupid tricks.
Oh,
because we were doing agility training, but like now that's got canceled. So now that I'm not training him to do stupid tricks in a ring, I can teach him to do stupid tricks at home. So
that sounds like a great idea. And then you'll have like a super impressive dog. So then like next time you go to a dog park, they'll be like, whoa, what classes did you take him? And you'd be like, I did this myself. COVID-19, quarantine, self-quarantine. Bam. That's a great idea. I wish I had a dog to train.
You've got a hedgehog.
Yeah, you can't train a hedgehog.
This is not true. You have got to be able to train a hedgehog.
She's like mostly litter trained, but I mean, she can't do tricks. She's not that smart. She's also blind. Like, I mean, she's nocturnal, so she's not really blind, but essentially she's blind.
Does she use echolocation like a bat or a dolphin?
No, she doesn't. She uses her sense of smell and hearing.
Oh, okay.
She's got a very, very keen sense of smell.
Okay.
So
I think maybe one more or two more suggestions before we wrap up. If somebody,
I have one more.
Okay, I'll do one. You do one, then I'll do one more.
I might do yours.
Okay, yeah, we might actually be.
We're thinking of the same thing.
I wonder if we are. You go first.
So the other thing that you can do while you're quarantined, since you maybe came upon this podcast and don't know what the heck it's all about, you can go back to our first episode and you can binge listen to stories from the trail, and you can listen to us and you can compare the quality of this show to the quality of our first show, which was, I believe, if I'm not mistaken, called our worst show ever.
Our worst episode ever, parts 1
worst
and 2.
Episode ever. Yeah.
And I believe it's still
episode 1.
Yeah, episode 1 was called our worst episode ever. And you know what? When we called it that, we were just saying that because it was like we were trying, it was our first time. I did not know that it would come full circle and that like a year and a half, 2 years later, however long it's been, we would be standing here and saying, that's really like, go back and listen to it. It's our worst episode ever.
We had no clue.
We had no idea. I had no idea we would be talking about a pandemic. I had no idea we would be interviewing someone with such bomb credentials.
So, yes. Thank you so much, Kathy.
Thank you, Kathy.
So lucky to have found you.
This is just what we needed.
Yeah.
We needed someone to bring some sanity to this situation and just talk about it with us, because it's a little crazy, but it's super important that we talk about it, especially since all of us love hiking so much, and it's near and dear to our hearts, and COVID-19 has kind of thrown a wrench in everything.
Yep, this is important.
I got kind of I actually have one more question. For Kathy, I'm just wondering, okay, so we talked about, why you shouldn't go hike right now, and, potential like things that could happen as a result of that. And other than just not hiking, like, do you think that there's anything, because I'm sure there's a ton of people out there just chomping at the bit right now saying like, screw that, I'm hiking, is there any way for like those hard-headed people that like, even if they're going to go, that they could maybe do something a little bit different, but
mitigate
still get
the
their
damage
take on that? Yeah, that could like mitigate their impact.
I would say, so this, it's the phrase over and over again, social distancing. Really try to avoid congregations of people and sharing close quarters, or if you do, have it be the same 3 people and don't have contact with anyone else at all. I think that's just really key, is maintaining good hygiene, finding ways to find hand sanitizer in a barren wasteland, and yeah, so good hygiene and avoid congregating in groups.
But stay home.
But stay home. Stay home. The best thing.
But yeah.
Yeah. For this year.
Yeah. Sorry.
Yeah. Probably best to stay home. My fear is that people are going to think like, oh yeah, I can totally do that. I can totally do that. But it's a completely different experience once you're out there. Like you might think that you can, for a thru hike, not go to a hostel, not go to a hotel, avoid eating in-town food. But to those people, I would say, have you ever thru hiked before? Because if you haven't, you don't know what thru hiker hunger is. You don't know how much you're going to want to do that. And I don't trust your will to be strong enough. Sorry. I just don't. Unless you have done a thru hike before and you know that you are able to say no to the hiker hunger, and you know that you're going to totally be able to do this because you've already done it before, then maybe, but may the force be with you. Please don't be around anybody else. Please don't touch me or any of my loved ones. And I don't see how that's possible for anybody who's never done a thru hike to understand how to even do it. Yeah.
When you're out in the rain for 2 weeks straight, you're going to want to go stay in a hostel or a hotel, guaranteed.
Yeah. It's a big enough task to take on, to just attempt a thru hike, not even doing the whole thru hike, but just attempting it is a large enough task that it's such a mental game. It really is. And so many people can't beat like they're taken over by that. We've already talked about this before, but the mental piece of the trail is huge. And there's really no way, unless you've thru hiked before, there's really no way for you to know whether or not you're going to be able to have the will to stay out of town and to stay away. Like they say, there's no way to prepare for a thru hike other than thru hiking. There's no way to know whether or not you are going to be able to have the willpower to stay away from people and stay out of town and stay away from town food unless you've already done it before and you know you can. And even then, I'm still skeptical. But
yeah, for sure. On another note, I'm wondering, I'm sorry I'm slacking on this one. I haven't done the research, but I mean, a lot of states are basically shutting down operations and things. Heard places are shutting down restaurants and things like that. Does anybody know of a resource? I saw like the Trek talking about something that was, they were going to post any sort of closures to any sections of trail towns or things like that. Because I mean, the thing is, like, even if you don't heed the advice that we're giving you and go anyway, you still might run into a section that is closed down because, right, the Forest Service or whoever is working that section might be like, F this, like.
Yeah, as far as I know, I don't think there is currently a consolidated resource of trail closures just because things are developing so quickly. I mean, it's 8 p.m. on Monday, the 16th. By the time you hear this, hopefully I'll get this out tonight, but, maybe somebody listening tomorrow, maybe that list has come out, or I don't know. Megan, did you find anything in your research today?
No, I did not find anything.
Kathy,
I just know that if you go on the ATC website, you can find if you go under About on their media room, there's like a whole list of different national parks that the trail goes through, as well as national forests. And elsewhere on their website, you can find a list of all of the places or the groups that maintain the trail. So, I mean, I guess if you want to thru hike and guarantee that you can actually thru hike, you're going to have to go and check every single one of those and keep up to date on it to make sure that it's not closed if you're actually going to go out and hike. I think that's why it was so important for us to do this episode and do it quickly, because just between Thursday, Friday of last week and today, there have been so many rapid developments with this, and it's such a fluid situation. And I feel it's so important that that people are aware and really pay attention and realize that, this thing that you might have been planning for months, years, decades, things have just been flipped on upside down. And it's on every individual person to do their research and to pay attention to not just the guidelines for how to prevent the spread of this disease, but also whether or not you're going to be able to stay in some of these places, whether or not you're able to hike through these places, what the rules are. It's on each and every person to do this research themselves.
Speaking of rapid developments, I just read that REI is shutting down all of its locations until March 27th.
Yeah, I saw that today.
Yeah, all their brick and mortar locations. Online is still available though. But
okay, but I mean,
physical location.
But even then, if you're hiking, it doesn't matter what trail, you're not going to be able to go to an REI store physical location,
and expect delayed shipping times because they're probably short staffed because so many people are staying home. I mean, it's just don't strain the system here. Stay home, guys.
Yeah, I think the big takeaway is that the system, whether it be the system you use to get to work, the system you use to get your goods, or the system that you use to get your healthcare, the systems are all going to be strained. They're all strained right now, and it's going to continue going in that direction. And I think it's on every single one of us to make sure that we are mitigating that as much as possible so that the resources end up where they need to be with the people who really, really need it right now, instead of on maybe this hike that we've planned for a while. There's other, a strain one place causes a chain reaction, but that's just my thoughts.
Yep. The trail will still be there next year.
It will still be there. I promise you. The trail will still be there. Isn't that one of the sayings? The trails up, something like that?
Yeah, that's a saying. Something like that.
That's a thing. We'll make it a thing. The trail will always be there. It'll be there next year. I'll be there the year after.
It's a thing now. You just made it.
It's a thing. Now it's a thing.
All right. We're getting.
Oh, wait. One more thing,
okay.
Real quick. I know something else that you could do while you're in quarantine.
Ooh, let's hear it.
What's that?
Read Green Giant's book.
Oh, another plug. And Green Giant's book is called Stories from the Trail. No, it's not. It's called Where Isn't Thy Shelter?
Yeah. And I guess you mentioned earlier that we're not really sponsored by Audible, but in our show notes every week, I put a link where you can join Audible for free. When you join Audible, you can hear Where's the Next Shelter for free as your first book. So if you're not a member already, and if for some reason you like my voice, you can get more of it. It's there in the show notes.
I mean, I wouldn't say go listen to the book because you like Gary's voice. I mean, Gary's voice is fine, but I mean, the book itself is good.
If you want to hear my Voldemort impression, you want to hear me?
Oh yeah,
talk like Megan. It's in.
Oh my god. Yeah, if you want to know what I sound like, or what I sound like in Gary's head, like when he thinks of what Megan sounds like, that's, if you want to hear that, okay. It's not super accurate, but I'm not going to make you record the audiobook all over again. Okay.
Well, thank you very much for bringing it up, Reptar. I'm flattered.
Yeah, no worries, Gary. I was just thinking, I was like looking and trying to find this like link to see about if there's a resource that is showing any sort of closures or anything like that on trail. And I ran across a post talking about like best through hiking films to watch while you're in quarantine. And I was like, oh, well, not only films, but books as well,
That's a great idea too. Watch a bunch of films on through hiking.
I would recommend.
There's so many other.
Even though I haven't seen it yet, believe it or not, I've not seen it. I would recommend Wild, because we're all going to watch it and then review it on an upcoming episode. So
we are.
You might enjoy that more or less if the movie's fresh in your mind. So add that to your Netflix queue or Amazon Prime or wherever it is.
Like chat.
Okay.
What the?
Oh, I don't know what
is that the dinner bell?
That's the that's the infection alert. Get down. Everyone to the basement.
Chat.
Oh God.
The last resource that I wanted to recommend as a place where you can usually get up to the second accurate information about the Appalachian Trail or the PCT or the CDT is on Reddit. I don't think we give Reddit enough props on this show, but if you go to Reddit and just type in the names of any of those trails, each one has its own relevant subreddit. And I can at least say for the AT subreddit, we do a good job of trying to keep things, current, family friendly, kinda, but, there's going to be, that's kind of where I think all the hot stories are going to get posted over the next few weeks. So you don't need to create an account to enjoy it. If you do want to create an account, you don't even need to type your real name or email address. You can be totally anonymous. You can even tell people you're a PhD if you want, and they'll believe you. So
we believed this one at least.
Yeah.
Which brings us back. Thank you so much.
Yes, thank you so much,
Kathy, for coming on the show. And thank you to all of our listeners for bearing with us in this type of episode. It's not what you're used to hearing. And I kind of got this bug last week and felt like we had to do something about it. And so I started blowing up Green Giant and Reptar's phone saying, can we do an episode on this? We got to do an episode on this. I mean, I don't even care if I just have to read a fact sheet from the WHO. We've got to do something. And then Gary went on Reddit and found Kathy there. Again, Dr. Kathryn Michels,
pure stroke of luck,
and who has real credentials, and found this post and reached out to her. And this is it's perfect timing. And it's something we all need to be paying attention to. So thank you for people who have stuck with us for taking this detour from the lighthearted stories from the trail with poop jokes and sitting down with us for an educational conversation. Because I think it's really beneficial, and I'm so appreciative to you, Kathy, for sitting down with us.
Wait, 1 minute.
Okay.
We have a through hiker on the show that has not.
Oh, God, you're right.
Yeah.
You're right.
So, we've got 7 minutes.
All right, doctor.
All right.
You are on the spot. Best poop story.
Oh, my. Okay.
She didn't know it was coming.
Okay. So does it need to be my own poop story?
Absolutely not. It's any poop story. Mine involves someone else's feces, so go for it.
Okay, this is actually before my through hiking days, because I have my system down for through hiking, and that's all pretty, nothing unexpected there. So pre-through hiking days, I was doing an outdoor adventure company. I was one of the instructors. And so we would come up with these absurd positions that, to recommend for pooping to the kids. We'd start with the sumo, where you just do a squat. We'd do with the throne, or you sit over a log. And we came up with one called the squishy grave digger.
Oh God.
which is where you dig a trench, like a reasonable sized trench. And you drop trow, and you begin pooping while like waddling forward and grumbling. And we had children do this and tell us about it. So,
oh my God!
And you have to mumble like you're an old man, like. And it's like, it's a lot of effort, because you got to make a trench that's long enough for you to waddle down, but also, deep enough. And yeah, it takes some effort to do the squishy grave digger.
Oh my God.
Squishy grave digger.
Oh my God.
So I'm imagining now, like, that there are some then children, now adults out there, who have a memory of pooping like this as a child, I really want to know if those people still can do that. If you happen to be one of those children that Kathy taught the squishy gravedigger to, can you please let us know if either A, that scarred you for life, or B, like now you know how to poop in a very artful way? Like, I want to know this stuff. So
yeah, I want to know if there's anybody else out there that has ever done the squishy gravedigger.
Yeah, if you even know what the squishy gravedigger is, we want to hear from you.
Yeah, is there?
Please email us at sftttshow@gmail.com. Please send us. I mean, send us something like anything, a note, a picture, a video. We'll take it. We just want to know that someone out there knows what this is.
We had something similar in Amish country back in Pennsylvania, where I'm from, called the careless plowman.
Oh God!
No, I don't know what I hate my brain sometimes.
Oh jeez!
Oh, the careless plowman.
Guys, wow,
that's so good.
Nice,
so good. Thank you, Reptar, for remembering to ask our very highly educated guest, about her poop story.
I mean, how often do you get to ask a doctor or a PhD about
I mean, it's not something I normally ask people.
That's what I'm saying. So
yeah.
I don't know.
She's uniquely qualified in all of these aspects.
Based on her Reddit username of Dr. Peanuts, that the poop story was going to be a little different, but okay. All right.
Man.
On that happy note, last thing before we sign off, I'd just like to remind listeners that Stories from the Trail is 100% listener supported. So if you are interested in helping us make this show better, or for some reason to make more of them, you can help out at patreon.com/storiesforthetrail, where for as little as $1 per month, you'll get access to our entire back catalog, including bonus episodes and raw audio. So more poop stories there for you if you're quarantined and have an extra $1. We appreciate it.
Yeah. Oh, there are more poop stories in those archives. Oh, there's some embarrassing stuff in those archives too. All
right, Megan, your prediction came true. Dinner is, I can hear the plates stacking in the next room.
I told you what I say.
You know, the only reason the only reason I agree to make this podcast is because it's the only time that Katie makes dinner for me.
Oh, isn't that nice?
Yeah. Otherwise, I'm actually, well, I love to cook. It's I'd call it one of my hobbies, like almost up there with hiking. Like, I just love putting on the apron and firing up the stove, and like I'll bake a batch of cookies or a tub of jambalaya, whatever it is. I'm all about the food, man. Yep, and it's
I gotta go make some food. I don't even know what I have. It's probably gonna be some. You know, we all stocked up on crap. You know, we got food from the grocery store. Like I know everyone did that. I did that. I'm probably gonna go eat some Cheez-Its because I don't buy Cheez-Its in my normal life. And I was like, quarantine for 14 days. I'm getting some Cheez-Its. Gonna finish that box within the first week or 4 days.
All right, so we'll put a bunch of links in the show notes for pretty much everything we discussed tonight, if I can remember them all. We will also include a link to Kathy's blog, if that's okay with you, where she writes extensively about her time on the PCT, along with some beautiful pictures. So that'll be there for you guys too. Thanks for sticking around. This has been a lot of fun.
Thank you.
Thanks, Kathy.
Thank you very much.
Thank you. Hey Gary,
and that's a wrap.
Do you think you can actually Siri came on when I said hey Gary. Do you think you can actually get this episode out with minimal editing?
Yeah, I'm basically just gonna do noise reduction and put it straight to tape as is. So probably by midnight tonight we'll have it.
We did so well.
Yeah. As long as people aren't too worried about quality, it'll be out tonight.
I don't know. I think that was good.
Oh, for sure.
We covered everything I wanted to cover and more. Kathy, I made a little outline here of all of the things I wanted to ask you. And
you know, when Megan shows up with an outline, shit's about to get real.
Shit's about to get real. I'm putting on my reporter hat, and I'm not a reporter. I've never taken the job.
I like to look directly into the eyes of the people who I'm disappointing. So this will be nice.